Thank you, Sue, and good afternoon, everyone. I hope you're enjoying the conference so far. As Sue says, my name is Verena Wallace, and I'm one of the senior midwifery advisors at the NMC. There are now many more of us than there were when I joined in 2019, and I think at the last count there's about 60 nurses and midwives spread across the NMC in all sorts of different directorates. And in this session, what I'd like to do is to take you on a brief journey with our standards and what they're saying collectively about holistic care and listening to women. So some of it will be a sort of revision for many of you, but our standards are now, and I can't quite believe this, they're actually now 4 years old. We published them in November 2019, and that was the standards of proficiency for midwives and also our programme standards. So the key points are that they reflect what the public can expect midwives to know and be able to do to deliver safe, effective, respectful, kind, compassionate, person-centred midwifery care, which are things that we can all sign up to. And there was a process with all of this. It wasn't that they sort of got written and then we asked people to have a wee look at them and say what they thought. There was a long run-up, and we did a lot of collaborative work, at least 2.5 years in advance of the standards going out for consultation in their draft format. And we asked, the NMC asked Professor Mary Renfrew, who was then at the University of Dundee and is now an emerita professor at the University of Dundee, to lead that work and on behalf of the council. And we had a thought leadership group, and we started off with a collection of folk. And I suppose it'd be fair to say we tried quite hard not to have the usual suspects. And that was actually a phrase that was used, because normally you would have, nominations from the chief midwifery officers and the RCM and everybody. And it's not to say they weren't there in the house, but they were also there with users of services, student midwives, midwives from practice, community midwives, labour ward midwives, researchers, and not just midwife researchers, but researchers from the other sort of related disciplines like the social sciences. And we had people from support groups and so on as well, all in the mix, and having robust discussions along the way, considering all the evidence. And what this picture shows you is one of our launch events, because we launched in the 4 countries of the UK, and you can see that there was a bit of a thing about cupcakes at the time and balloons, and there were various babies in the room. And it's a fair point to say that from the thought leadership group, many of the folk who started off as students with us, by the time we'd finished and published the standards, they'd actually got themselves on the register and got their degree. So they'd been able to use us, hopefully, as part of their sort of work when they were doing their degree. And what we did was we were very careful to look at the best available evidence that was available from both the global perspective and also locally. And that was taking into account the strategy documents from the 4 countries of the UK, the reviews, the reports, and of course Morecambe Bay would have been the big report that was coming into play at that point in time, as well as having that underpinning of the code, and also what was agreed by council was that we would also knit in and have as the sort of framework what's called the Framework for Quality Maternal and Newborn Health from the Lancet series. And this Lancet series is absolutely crucial, because you'll see what's in the Lancet series reflected in the domains of the standards of proficiency. So this seminal body of work was again an international piece of work that came out in 2014 and ran over a series, as it says says on the tin, in the Lancet, which is one of the top peer-reviewed journals that you can come across, again from a global perspective, and is read globally. So what came through from the framework is the reflection around universal care and additional care. And if you look at the top line, that's where that comes in, because there's care that all women and babies need, and then there is additional care that some women and babies with complications need. And it also covers the practice categories, and that's things like sort of health promotion, public health, assessment, care planning, and optimization of normal physiological processes, and then the additional care that's needed for the mother or the baby. You've got the organisation of care, taking into account continuity. You've got the values around respect, communication, knowledge and understanding, and care tailored to the woman. So that's where you're starting to see that idea of person-centred and the woman at the centre of care. And that's sort of coming out as well in terms of the philosophy around expectant management and intervention when it's needed. And then around the care providers, again, thinking about practitioners combining knowledge and skills with the interpersonal and cultural competence. And I would say that that's now moved on into probably the space around cultural curiosity, because you have to maintain both an intellectual curiosity and a cultural curiosity as you go through life generally. You'll never be able to know all the cultural nuances that you need to know, but it's about having the understanding that you're always going to be learning, and that you're always going to meet something new, because there will be something that will come in that's new. So you've got everything sort of diagrammatically on one page with this, and then that reflects over into the standards of proficiency, where you've got 6 domains, and as you look at them, you'll see they're all important, and we put them in the round because there's not a sort of hierarchy to them. They're all important in their own right. And it's about moving from that accountable, autonomous, professional midwife, and then into safe, effective midwifery care, and that's around continuity of care and carer. And we link that very closely because the evidence is very clear about the benefits to the baby of continuity of care and carer, the benefits to the women in the sense that they like not having to repeat everything multiple times to everybody. And also it's starting to come through in other professions now. We're starting to see people recognising that, for instance, in GP services, it's much better to have continuity of care from a GP point of view. So it's interesting that continuity of care is coming in with us and has been around for a long time and is now starting to be reflected in other parts of the healthcare world. The universal care is what I referred to earlier about women and babies with complications who need a little bit more at various points. And then the additional care, and then the promoting excellence, which is the midwife and the sort of leadership, scholarship, and collegiality that comes in to midwifery from the get-go. And then all of the skills and everything pulled together in the Domain 6, the midwife is a skilled practitioner. So the next couple of slides are just a little bit that's in the front, and I sometimes think maybe gets missed out, but it's about thinking about the future midwife, and this is the role and scope of the midwife in the 21st century. And it's the skilled, respectful and compassionate care and that provision of that, the working across the continuum, and then the enabling and respecting human rights. And their priority is always this bit about focusing on the needs, views, preferences and decisions of the woman and the needs of the baby, the newborn infant. And there's more about the optimizing of normal physiological processes and safe support, and that it's situations in the broadest sense. It's not just safe physical, it's safe psychological, social, cultural and spiritual situations, and spiritual again in the widest terms. It's not just about religion, but it's whatever sort of gives you peace and joy and so on in your life. So it's about making that sort of atmosphere and the environment as good as it can be for the women. And that's about the safe, respectful, empowering, equitable care, and irrespective of the social context, because we all know that we meet everybody from across the entire social spectrum when we're in the midwifery world. And all of this is threaded through with the ideas behind communication. And we would say that one of the golden threads that runs through everything is the idea of communication. And this is pulled together in the standards in Domain 6. And going back to the Lancet framework, communication is absolutely key. And we've pulled together in Domain 6 all the communication skills that go right across Domains 1 to 5, and that golden thread. So we've heard from more recent reviews, for example, thinking of Kirkup and so on, that women will sometimes reflect that they don't feel they were listened to, or they were heard and understood, and then that sort of acted on. So we've tried to address this in the standards and have gone through quite a lot on the sort of actively listening, thinking about appropriate use of questioning, clarification techniques, and responding to questions with kindness and compassion. And I'm not saying that any of this is easy, but this is where, for example, I think when we're thinking about the curriculum and teaching of students, and if you're in an environment where it's possible to use things like simulation, you can practice difficult discussions beforehand so that the first time the student's having them is not when she's face to face with somebody in a sad or very awkward sort of conversational piece. So it's about thinking about practicing those conversations and dealing with them with kindness and respect on both sides from the get-go. And there's other things around translation and interpretation services. And I don't know if anybody was listening to Radio 4 yesterday, but there was quite a sort of thought-provoking session, I can see nodding, which was all about just really how, rather like it's a phrase I use occasionally, which is, it was rather like a curate's egg, in the sense that interpreting services across the UK, both in healthcare and in the judicial system, etc., in the courts, is you could only describe it really as good in parts. When it's good, it's very, very good, and when it's bad, it's not really good at all, in essence. And about the importance of interpreting services in the context of healthcare. And of course, that's absolutely, as we know, crucial in the sense of looking after women, particularly when they're going through our services and they're in labour. So this is hopefully something that will improve, as it's definitely challenging, and it's very, very difficult to, particularly in emergency situations, communicate. So again, we've points in the standards about effective communication with interdisciplinary and multi-agency teams and colleagues in challenging and emergency situations. And again, that's where the practicing for practice can come in that sense. So going back to the idea of universal care and additional care for women who experience complications, that includes the sort of sphere around communication around support, accurate information and update on changes, often in the middle of what's a very challenging and rapidly changing situation. So it's about continuing to listen, responding to their concerns, their views, preferences and decisions, which again links back to what we first looked at in the Lancet framework. And there's a lot about the use of communication skills when you're thinking about feeding and the baby, and those sort of techniques around the effectiveness of feeding practices. So all of that, and you can tell by this that I've just got the hang of doing QR codes. So I'm sticking QR codes randomly in the presentation, having finally found the button that turns it into a QR code. So thinking about this in the context of person-centred care, which is really what holistic care is all about. Because the word holistic care, you think, well, what's all that about? But in actual fact, it's really person-centred care. And again, that's been around for a long, long time. And when I was preparing for this talk, I found a framework from Scotland, which quite disconcertingly was from 22 years ago, which talked about a holistic approach to care during pregnancy, childbirth and the postnatal period to maximise and improve continuity of care and continuity of carer. So, like I say, it's probably, looking around, it's probably older than some of the folk in this room, which is depressing. But anyway, it's also part of the picture in international care, in the sense that that first quote is from Australia, and then we've got something from England around integrated care and person-centeredness. And for those of you in the academic world, you'll be aware that the University of Ulster, which, as you can tell from my accent, is sort of my part of the world, is Professors Brendan McCormick and Tanya McCance, and their research and their PhDs sort of brought this to the fore, and their publication really emphasised this in the world of nursing, particularly from their point of view in the world of care of the elderly. But it's absolutely core and central to the world of midwifery, with having the woman and the baby at the centre of care. And often with holistic care, it's the little things that matter. And we've mentioned holistic care in the standards, and that's building on what we've got in Domain 6 and thinking about the assessment of all of those factors, the whole sphere of the woman's being in the sense of physical, psychological, social, cultural and spiritual health and well-being. And what we've been able to do recently as the NMC is sort of work with our rather fab comms colleagues and think about the best midwifery care happening in partnership, because key to the person-centeredness and key to the communication is a partnership and a relationship sort of approach to care, because you're developing the relationship, and that's what takes you through from the beginning of pregnancy into the postnatal and beyond. And what we've come up with is something which can be useful for students, hopefully, but also for anybody who's working with students or for yourselves in the sense of revalidation. We've got some on the stand, but it's about the best care happens in partnership, and it's thinking about, for every pregnancy, listening, supporting and acting for women, and sharing hope, sharing anxiety and sharing joy, which is par for the care that we do give. And it highlights how compassion, active listening, responding and effectiveness are at the heart of care, as it sort of says on the slide. And again, for those of you with smartphones and QR codes and so on, there is a link to the page. And while I'm not going to torture you by playing the entire webinar, Jackie and I did, as part of this, talk to two women who told us about how their midwife had listened to them and what a difference it had made. And it goes back to my point that sometimes it's the little things that count, because you can have communication on the grand scale, but for us it's about as much the communication on the one-to-one. And there's a series of case studies, but the two folk that Jackie and I talked to in our webinar were Simone and Sophie. And Simone's key point was really that she says, I always felt they were happy to see me and hear how things were going. I never felt that I was a burden. And when it came to talking about your birth plan, what you would like, they listened, they wrote it down, and it was communicated correctly. So when it came to the birth, they knew everything I wanted. And it was especially important to feel listened to at that time. And neither of these have sort of completely uncomplicated sort of stories. Simone, and she says this in the explanation and in the webinar, she'd had a history of miscarriages. So she wanted people to understand that without her having to repeat it endlessly. And also take that into account when she was anxious and afraid as her labour was going on. And also what we heard from Sophie was that Sophie'd had a home birth planned, and then it hadn't quite gone according to plan. But interestingly, what she said was, my midwife always made me feel like I was the most important person. She'd wanted a hands-off approach, and she was there enough, but not too much. So the midwife sort of took on board what she said. She heard that, and she acted on it. She gave me encouragement and reassurance when I needed it. I'd never done this before. It was so important to have words of affirmation and to be told what was happening. And what that actually turned out to be was that it meant that Sophie had written down in her birth plan certain words that she wanted to be used while she was labouring. And I suppose the sort of illustration of it would be not using the word contractions, but using the word waves or surges, that sort of element. And she knew that the midwife had read her birth plan because the midwife reflected that language exactly back to her during her labour. So she didn't have to sort of worry that she was going to have to think about, no, that's a negative sort of language that I didn't want to hear. She got this positive reinforcement and affirmation of the language as she was going through the birth. So if you want to, it's possible to see the webinar with Simone and Sophie on YouTube. And just thinking about some of the other resources that we've got for students, but also for midwives and for use in practice, and also when you're thinking about revalidation, we've got Caring for Confidence, little video clips, bite-sized animations, I think is the technical term, about the code and thinking about how it can sort of support you in practice. And that covers accountability, professional judgment, delegation, speaking up, being inclusive, challenging discrimination, social media, as you say, and there's a key one on person-centred care, end of life and professionalism. And while these do go across the professions that we regulate, you may find it interesting to have a specific look at the person-centred care and the professionalism and so on, and the accountability. So we've been on a bit of a roll with providing resources, and the other point that we've done is we've pulled together all the resources for students into sort of one place. So it pulls together the code, our role in education, the social media guidance, because that's quite a big thing, and then there's newsletters. We do newsletters for students, we do newsletters for midwives, we do newsletters for nurses, employers, so on. So you can sign up and you'll get an email newsletter on a regular basis, depending on which one you want and what you sign up for. So we also cover duty of candour, health and character as a student, and raising concerns as a student. And like I say, we've pulled it all together in one place, because I have to say, hand on heart, that our website couldn't be described as an easy one to navigate. And I work in the organisation. But anyway, we're moving on from that, and we do have very clever IT people who are trying to sort that out for us, and this is part of what they're doing. We've also done something else, which is when we were out and about, we were getting slightly perturbed, or more than slightly perturbed, by the worry that students were experiencing about the NMC in the sort of big bad wolf sense. Because people were saying to us, well, we're really worried about losing our PIN, and we have to do everything right because we're going to lose our PIN. And I was thinking to myself, but you haven't even got it yet. So what we're trying to do is to, in a way, demystify the NMC at different points. So first year, second year, third year. And what we've got are some little videos that are available, which are the NMC, talking about the NMC, and sort of emphasising the point that while fitness to practice looms large, it's a tiny, tiny, tiny 0.1% of the register who ever get anywhere near it, in that sense. So for everybody else, hopefully what will be a career length relationship with the NMC can start positively with the standards, then with joining the register, then with the support, again, from post-registration standards and in the sense of revalidation and so on. So we're trying to sort of get that message across with thinking about your journey, getting the best out of your education, finishing your programme and what's next, and having that as sort of a positive introduction to the NMC, because focusing too much on FTP would scare well, yes, there's a couple of Irish phrases which I'll not go into, but anyway. So moving on that one, we've also got one which is around the student supervision and assessment, and we've got now it all again pulled together in a SSSA supporting information hub, and we've got a little animation again about hopefully understanding student supervision and assessment, because that's been that had a little bit sort of one step forward and two steps back because of the intervention of a global pandemic, where we sort of stuck to mentoring because we didn't want more change on top of more change. But we're now in the phase of absolutely, this is what our standards are about, which is about SSSA. So this is hopefully some supporting information. And I can't lose this opportunity to talk a little bit about what we're up to next, because we've always got something that's coming up next in the sense of the NMC. So a couple of years ago, we committed to looking at advanced nursing and midwifery practice and thinking about whether we actually needed to regulate it. And we've done some sort of initial work, and we had some feedback from the Nuffield Trust, who are an illustrious research company, think tank, who looked at this collectively and came back to us. And they were able to tell us some pros and some cons, but what they were sort of saying in essence was that more nurses and midwives are taking on advanced practice roles. It's still unclear whether people who use those services understand that and what it means to them. And I would say it's not just the public, it's, you know, the rest of us in the room, as it were, and in practice. And there has been some sort of chatter, I would say, in the journals around where it's the naming of somebody as an advanced practitioner hasn't necessarily worked well, because they've been somebody who's not even on a register, in the sense of, but they've got advanced in their name badge, which is confusing and not particularly good from a safety and information to the public point of view, because we shouldn't be expecting people to know what part of the register we're on from looking at our badge, but it should be very clear what the levels are and what you're expecting. And there's some value in thinking through at this stage whether regulation is the answer for us or whether regulation isn't. And it's also worth noting that in the sense of where is it regulated? And I've said this at the lunchtime session that some of you were at earlier, our nearest neighbour in the sense of the Republic of Ireland does regulate advanced practice for both nursing and midwifery. So needless to say, we're chatting to our friends over the border and hoping to pick their brains about the strengths and weaknesses of the approach and how it works for them and so on. But we do have advisors who've come in to the NMC on a part-time basis to act as midwifery advisors in the advanced practice space. And I'm going to embarrass Pamela by making her stick her hand up and highlight to you that she's the NMC for advanced practice. So if any of you are interested, please do see her afterwards, because she's a woman with a mission, because we're hoping to take, papers to council, who are the governing body for the NMC, really, to put the options to them and sort of get their agreement or whatever on whether we go forward with regulation. And it's not just nothing or regulation. There's about 6 options in between, including things like credentialing, which I can just about say, but I wouldn't be able to probably spell it or tell you too much about it. But it's one of the options along the way that's in between sort of zero fat and full fat regulation, as it were. And we do have midwifery advanced practice advisors from Wales, Northern Ireland and England as well. So my connection seems to have been lost, possibly. Oh, no, there we go. So, and this is my last slide, so you'll be glad to hear. So if any of you are interested in advanced practice, this is our thing at the minute. So there are links there. There's various engagement opportunities going on all around the place. And Pamela and the other advisors are trying to speak to as many people as they can so that they've an informed base before we go to council. And again, taking into account what the Nuffield Trust have said and what we're finding out from colleagues across the border and in other parts of the world. So if you want to, there's also email links there for Pamela and for the advanced practice team. So I'm aware that I've been talking for a while, so I'll stop now and hopefully I may have generated some questions for you. So thank you very much.